they call it like a fingerprint. So my cancer is they take a part of my pathology and they make a fingerprint, they call it, of my specific cancer. And they're looking for that every single time they do that blood work to see if that fingerprint of my pathology of my specific breast cancer is present in my body. And as I began to read that and realize what that really meant, I just thought, I don't think I want to do this. So when I went back to see my oncologist the next time, he went with me and we had a conversation, and I just told her, I just don't think I want to do this. I don't think I want to carry this anxiety. And she looked at me like, are you crazy? Just like my husband did. And so she was so great. We talked, and Rome, honestly, she said something to me that, well, two things that really impacted me and caused me to think, kind of shift my brain a little bit. One was, what's the point of science if we don't use it? And that was
that's a powerful one.
Yeah, that really stuck with me. And she just said, Mary, why are we doing all of this research? Why are we studying all of this if you don't want to use it?
This is Genetics for Healthcare, a podcast for patients.
This is Genetics for Healthcare, podcast dedicated to patients and their caregivers to help advocate for a precision medicine approach to their care, which includes treatment, disease screening, prevention, and survivorship. You can find us at geneticsforhealthcare.com. From there, you can connect with us on any of our social media platforms. Please follow us on your favorite podcast platforms, Spotify, Apple Podcasts. We're also on YouTube, LinkedIn, Facebook, Instagram, and TikTok. While you're there, hit that subscribe or follow button, especially on LinkedIn, so you can get exciting new updates for episodes like this one. I'm really excited about this one because we're going to talk about a new technology, a really new technology available to detect the presence of cancer before you have symptoms. It's called MRD testing, or molecular residual disease. Some call it minimal residual disease. It detects tiny amounts of the DNA from cancer cells that are circulating in your blood. Recently spoke to Dr. Ronan Kelly, great guy. He is the chair of medical oncology at Baylor Scott and White Healthcare System in Texas. He had a great analogy. It's like brushing your hair. Obviously, I don't have hair. I do have a beard, but when you brush your hair, sometimes those hair follicles are shed from your head. This is similar to what happens in the body when fragments of cancer DNA are shed and they float through your body. Today, we have Mary Royal to share how she conquered breast cancer and also share her experience with MRD testing. Mary, thank you so much for being a guest on Genetics for Healthcare.
You're so welcome. Thanks for having me, Rome.
So I heard you speak at the American Society of Clinical Oncology, huge meeting for the oncology, cancer research, drug development industry. Upwards of 40,000 people attend this in Chicago every year. And Mary was a speaker talking about her experience with MRD testing. But before we get there, Mary, can you share a little bit about your background? I know we spoke before we started recording, but share a little bit about your background and the events that led to your diagnosis of breast cancer.
My name is Mary Royal. I am 53 now, have 4 kids, married, work, all the things that normal people do. I'm very healthy, never had any health concerns or problems, don't have parents that have health concerns, was just running through life. Dropped our 3rd child off at college and went in for a routine mammogram that I had neglected over the past few years, COVID, those kinds of things. And went in for a routine mammogram. It got called back the next day to come back, which wasn't necessarily uncommon for me. I'd had that happen before. And so went back in and did that imaging and realized pretty quickly that it was a little bit different. Went to see my primary care physician, who let me know that they had spotted a lot of spots on my breast. And so long story short, that was August 21st, 2023. By the next Monday, I was in for needle biopsies and found out about 10 days later that I had invasive lobular and ductal carcinoma. I had what was called multicentric, meaning that it was in all quadrants of my breast. It doesn't make it any worse, just different, not like one tumor. There were lots. And I had a lot of decisions to make. So that came in like a storm. We were living life very normal. And like I said, no health problems. I'm a runner, eat fairly healthy. And August 2023 kind of changed our lives.
In simple terms, once you had a conversation with your doctor about what the treatment would be, how did she introduce this test of MRD or circulating tumor DNA to you?
So every story of cancer I'm learning when I meet with people is so unique. No two people have the same cancer journey. Those nuances make it complicated for sure for physicians and for medicine. But my particular type of cancer was hormone receptor positive and HER2 negative, which for the cancer world means that it's not aggressive, but that it was driven by hormones. And typical treatment for that is to maybe possibly do radiation if the tumors are big enough, but mostly just to take endocrine therapy to kind of suppress the hormones and do it that way. So that is, and I had chosen to have a double mastectomy, bilateral mastectomy, because of the multicentric. And so my plan of action was to have the surgery and then hopefully to go on and just do endocrine therapy. When I had my surgery, my doctor found a little nodule near my sternum in the middle of my chest that he was hoping was fatty tissue or maybe a traveling lymph node. But come to find out, it was invasive carcinoma as well. And I was also node positive. So that really flipped my script room and made it a little bit different. And I had a lot of decisions to make at that point because chemotherapy is really for aggressive cancer. And mine was HER2 negative, but it had also traveled a bit. It was still considered stage 2B. There were a lot of decisions. So at that point, I met with my oncologist. So I was a little non-traditional, like I said, in hindsight, looking back. We probably would have done treatment first, but since we didn't know those things, I did bilateral mastectomy first. So when I met with my oncologist, we chose together to do chemotherapy and then to do radiation. Go ahead and just alleviate all the what ifs for me. And it was a decision that I knew was the right thing for me. So MRD testing was not introduced to me. I saw her in November of 2023, and she introduced it to me in January of 2024. So about 3 months after I had started chemotherapy. And the way it was introduced to me was in her office. And she said, I would like to do MRD testing with you. And she called it ctDNA, which is circulating tumor DNA. I had never heard of this before, had no idea what it was. She explained it to me, kind of like you did, that all of our cells slough off into our bloodstream, our DNA, and that this was a way for them to test and check if my specific cancer, breast cancer that I had, was still in my body and was sloughing off, that DNA was sloughing off into my blood system, my bloodstream. So, all the words, and I was listening, but thinking, I have no idea what she's talking about. I had never heard that. Like I said, I'm an average human being that's not in the medical world. And so, of course, I went straight home and went straight to Google, which is where most of us go, and, researched it and looked it up. And it was like, wow, this is fascinating. I didn't even know that our DNA sloughed off into our bloodstream, like you said. So just kind of trying to wrap my brain around what that would look like. And as I was reading, I realized that they call it like a fingerprint. So my cancer is they take a part of my pathology and they make a fingerprint, they call it, of my specific cancer. And they're looking for that every single time they do that blood work to see if that fingerprint of my pathology of my specific breast cancer is present in my body. And as I began to read that and realize what that really meant, I just thought, I don't think I want to do this. That was my first thought, to be honest. And I just thought, why would I want to know that information? People that have cancer can relate to this. I think they call it scan anxiety, just the anxiety that now something has taken over your life. And every single time you go to the doctor to have testing, there's going to be that anxiety. What if this comes back? What if I get this again? It is a reality for all of us that have been diagnosed with cancer. And so this felt for me like, I'm going to know this long before a scan picks it up, long before we know. And it just felt like, I don't think I want to carry that anxiety. So that was my first initial thought. I told my husband that, and he said, "You're crazy. Like, why would you not want to do that?" We're very different. He is a highly anxious person. I tend to be like more, you know what? Out of sight, out of mind. I'm not going to deal with that. So when I went back to see my oncologist the next time, he went with me and we had a conversation. And I just told her, I just don't think I want to do this. I don't think I want to carry this anxiety. And she looked at me like, "Are you crazy?" Just like my husband did. And so she was so great. We talked, and Rome, honestly, she said something to me two things that really impacted me and caused me to think, kind of shift my brain a little bit. One was, what's the point of science if we don't use it? And that was
Wow. That's a
really,
powerful one.
yeah, that really stuck with me. And she just said, "Mary, why are we doing all of this research? Why are we studying all of this if you don't want to use it?" And my concerns, of course, were, okay, so I get a positive test back. What next? And that's kind of where the new research is right now, is what are we going to do in that intermittent time? And I was like, I don't want to be in that intermittent time. I want to already know what we're going to do. And the second thing she said was, we're going to do everything that's available to us, because there is so much research every single day in cancer. There are new things coming out. There are new medications. There are new treatments. And so if that were to be your story, then we will do whatever we can. And then we'll have the option to be able to scan you, more regularly and find out, is something present or is it there? So that in a nutshell is how I was introduced to ctDNA testing.
So I want to make sure that our listeners and those who are watching, there's some key terms there that you mentioned and some that you didn't, that I want to make sure that they have the language when their doctor says these things, that they can catch on to it or bring it up in these conversations. So first of all, MRD testing, molecular residual disease. Again, some call it minimal residual disease, but they're looking for circulating tumor DNA, the fragments that break off of the cancer cells that end up circulating in our body and could lodge in or travel to other parts of the body. If we're, in this instance, talking about breast cancer, it could lodge in your lung or your brain. So this test gives us the ability to detect those before you're symptomatic or it shows up on a scan. Secondly, they may call it liquid biopsy. Many may be familiar with a biopsy where they stick a needle into your body to test and see if there's cancer there, like a colon cancer biopsy or a skin biopsy. They just take a piece of your skin and they analyze it to see if there are abnormal cells. Well, in a liquid biopsy, they're going to take your blood and look for those cells, those abnormal cells that are floating around in the blood. Here's the big so what. Here's the big aha. Through these methods, and you'll hear next gen sequencing, as we talked about on other podcasts. This is the way that the technology to sequence those genes to find what's abnormal and what's native to you, normal for you. These technologies can be so sensitive to detect one fragment of a cancer cell amongst 1 million normal cells. That's how sensitive this technology is. You mentioned that it created a little anxiety for you. Now, since I've known you, I don't see no anxiety because you're a very spirited champion for this technology. So obviously the conversation you had with your doctor really did something. So tell me about that process. You obviously had your husband there, but how'd you move from, being very hesitant to agreeing to do it to becoming an advocate for the use of the technology?
That's a good question. I think personality plays in. So for anyone listening that might be thinking about doing this, everybody's personality is different. So I don't like to think about getting cancer again. I mean, I don't think anyone likes thinking about that. So I think that was a hurdle to get over. Was I can either choose to go, you know what, I'm not going to get cancer again. I'm not going to live in that fear, which I try not to every day live in that fear. Or I can face it head on with the facts to realize that I actually do, according to statistics and studies, have a high risk of recurrence because of the way that it traveled. Was already traveling. And so I can choose to look at that one of two ways. I can choose to go, I'll deal with it if it comes back. Or I can choose to go, I have this opportunity to find this early. Now, it's going to cause anxiety. If I go back and I have a positive MRD test, which I have not yet, we can talk about that in a minute, I'm going to have anxiety. I'm going to be sad. I'm going to be, oh my goodness, this is in my body. But I can go, there is an opportunity for me to possibly do something to catch that at its very earliest versus kind of burying my head waiting for a scan. And like you said, I've already got a tumor on my lung or a tumor on my brain, if that makes sense. And so I think the hard part, Rome, is facing those things, because nobody wants to think about that. I don't want to think about that occurring. I would rather just go, I conquered this. It's done. That was a piece of my life and I want to move forward. So it's that juxtaposition of really carrying both, but not living in fear. And it's tough. It's hard. But at the end of the day, I landed with, gosh, if I had the opportunity to know, and I think the lead time that studies are showing is about 15 months, anywhere from 15 to 36 months that you're finding out before. If I had that opportunity, if somebody came to me, if I didn't have cancer, if I came to you and I said, hey, you have the opportunity to find out if you were going to have a disease that can possibly be terminal, but you could find out 15 to 36 months before and catch it and treat it, would you choose that or would you choose just to wait? I think those are the things that we have to think about. And I think as science is moving forward, it's moving so fast that those of us that don't do science, it feels just overwhelming, I think, at times. And I don't remember who I talked to. She was like, this is like you're going to the moon for the first time. And that's really kind of what it is. And so what if he wouldn't have taken that chance, the astronauts, what if they wouldn't have taken that chance and gone to the moon? We wouldn't have that footage and all of the things that we've learned about it. So I think it's just kind of choosing to see it. It is a little bit of the unknown, but also, gosh, I may be able to get ahead of this and treat it. And we all know that the earlier we can treat cancer, the better prognosis we have.
I just want to take a minute and just honor your courage. Not only your courage to lean into this, these tests in some cases are not covered by insurance. They are covered by Medicare for certain use cases. I'll share that in a minute. But not only did you have the courage to lean into something that's new and innovative, gosh, you just using your voice in the way that you have in that event that I saw you and met you at ASCO, but also coming on Genetics for Healthcare, because this is our mission. Our mission is to really share patient stories and connect with those out there who may be in a similar situation so they can have the language and the confidence to have these questions with your care providers. So you did mention that it was explained to you that you can catch or detect the presence of circulating tumor cells 15 or more months greater. And we all know that early detection leads to long-term survival. It leads to conquering cancer or any disease. And if you have the ability to have a 15-month lead time to know that there's something there before it becomes symptomatic or before it shows up on a scan, that could be very, very empowering. If there's someone out there that is in a similar situation, and this is not necessarily routine testing, what advice would you give to other patients who want to access cutting edge monitoring in the way that you did? That may be a little hesitant to lean into it.
I'm sure people, if they're listening, there's so much online. There's so many places you can go for support or groups that you can join. And one of the things I learned really quickly is that you can fall into a really negative mindset with people and people that have cancer. And so I had to be really careful about who I listened to, the voices that I was hearing, the doctors, because online now there are so many people, you can hear so many people. So I love to, listen to physicians that are breast cancer doctors, that are oncologists. But one of the things I would encourage people is information. Do your research, do your study. It's at our fingertips. With AI, with ChatGPT, you can ask questions. And one of the things I learned just by sitting around people during treatment was they didn't know what was happening to their body, and they didn't ask questions. They don't ask questions. They just kind of take whatever people say. And I don't know if that's just something inside of me. I want to know what's happening, So as soon as it happened, it was like, what is happening to me? And, I talk to people a lot and I'll say that have breast cancer and I'll say, what were your receptors? And they're like, I don't know what you're talking about, and it's like, find out what your cancer is. And it is scary. I mean, you and I just talked about it. There's no doubt about it. So I think the first step is just, embracing the story. And that takes a bit. I feel like it took me a full year to fully embrace that. But just educate yourself, read about it. The more you read, the more information you have, I think the more settling things become, because when we have knowledge, we're empowered. And I think that's really important. So I would highly encourage, second of all, if you go to a physician who just says that they will not do this, and I have definitely heard that online, that there are physicians that are like, no, I'm not going to do this. And the main reason is because there isn't protocol for what to do next if it's found. I think that's the main reason is we don't know what to do. That's what I hear. We don't know what to do with it. But like I said, my doctor was like, research is coming out every day. I mean, just if the only thing we did was scan our bodies to make sure that there's nothing there, that would be a win, right? Because we're only having scans once a year or whatever the person's protocol is. So I think it's really important that you and your doctor agree on things. And so if you don't, I say you find another doctor. I mean, that's how I feel about it. I was so blessed to have an amazing oncologist who is a huge advocate for me. And she is very much like, we're going to do whatever we can to keep you here with your family and your kids. And I just appreciate that. So if you have a doctor that is not agreeing with the things that you want, find another doctor. And I know that's hard because you have to start over. It's kind of like when you have a therapist, you're like, I don't want to go to another therapist. I got to tell them my story again. But it's worth it in the end, to have somebody who can be an advocate for you. And if you have to travel, I traveled for some of my doctors to Dallas, because there wasn't someone here that was a good fit for me. So my oncologist is here in my town and she's wonderful. So I just educate yourself. If you're wondering what it is, read about it. Have a conversation with your doctor. There are forums online that you can go to. Research, find out who is doing the best and who is the most innovative, and just be an advocate for yourself. Because someone told me this early on when I had kids, and it's resonated in every area. You are your only advocate. Not that other people don't care, but they're busy. Doctors are busy. They see hundreds of patients a day, especially oncologists. So you have to advocate for yourself because no one's going to advocate for you. So that is a huge one for me is, get my head out of the sand, which for my personality is hard, and read, educate myself, and ask questions.
Absolutely. And I appreciate you sharing that. There's just full disclosure for those listening. Genetics for Healthcare is not sponsored by the company that did Mary's testing. There are multiple companies out there. There are differences, different nuances for those tests. So please do your research. You can go to Dr. Google, you can go to ChatGPT, but more so than anything, have the conversations with your care providers. As she mentioned, knowledge can be powerful. We all have heard that adage that knowledge is power. Well, not necessarily. Applied knowledge is power. We have to be able to take the knowledge and do something with it. So let me leave you with this. There are certain indications, as Mary mentioned, it's not widely used. There are so many doctors who do not use this test because it has not made it to their treatment guidelines yet. However, there are some specific indications for MRD testing that Medicare pays for, maybe not covered widely through private insurance. In colorectal cancer is the highest use case of this technology today for stage 2 and 3 colorectal cancer patients after curative therapy. That means after surgery or after chemotherapy to assess if you still have molecular residual disease or these tumor DNA floating around in your body. Also, they can use it for long-term monitoring, serial post testing after you finish treatment, which is your case, Mary, for surveillance. For Breast cancer. The indication that Medicaid pays for is high-risk early stage 1, 2, and 3 HR positive, HER2 negative breast cancer after surgery. So detecting MRD before imaging relapse. It's, again, not widely used, but Medicare does pay for these tests in that situation. For non-small cell lung cancer, it is paid for to monitor response to treatment for immunotherapy. And that's in advanced non-small cell lung cancer. And I believe immunotherapy monitoring, you can have this conversation with your doctor, and your payer will also pay for this to monitor how effective that treatment is long term. So again, Mary, I can't thank you enough for just using your voice in this way. I got to ask you, because you so powerfully speak about this and share your story, what's been the most rewarding part of helping really be a voice to do this? Now, in the life science industry, we all know about these technologies, but this conversation isn't mainstream. There are so many doctors, as you mentioned, that don't use this technology. But what's been the most rewarding part of you sharing your story?
I think the most rewarding thing right now, crazy, is that it's with the medical field because, like you said, it's not well known among just cancer patients. And I think most people that are in the oncology world are there because they want to help. I mean, I can imagine being in that area of care. And so I think for them, just when I'm speaking or talking about it, it's so empowering and encouraging for them to go, oh my goodness, all of the work that we do every day, looking under that microscope, doing all of the hard work of meeting with patients, to hear another patient say you're making a difference by the work you're doing has been so rewarding. Because I just don't think they hear it. People are so down on the medical world and, they're just, we're a number and we have to deal with insurance. And yes, there are complications and headaches and nuances, but there are people in the industry that are doing it because they care and they want to find a cure and they want to help us. And so it's been really rewarding for them to just come up with tears in their eyes and say, thank you so much for reminding me why I go to work every day. And that's been really rewarding.
Yeah, I can tell you're a different breed. You're a marathoner. You're a runner, and you also are an advocate for young kids in your day-to-day life. Tell us a little bit about that.
I am a forensic interviewer at a child advocacy center, just about to celebrate in a couple of weeks 10 years. So I interview kiddos who have made an outcry of abuse to law enforcement or CPS. And then if it goes to trial, I testify in court on behalf. So I advocate for kids. It's been an amazing journey.
Incredible. Mary Royal, breast cancer conqueror and MRD testing pioneer. Sure. Thank you for being a guest on Genetics for Healthcare.
Thank you for having me, Rome. It was great.
This is Genetics for Healthcare, a podcast for patients.